Hi, I'm Susan Formby. I'm a care consultant with the Alzheimer's Association in Georgia, and I'll be taking you through the next module on the progression of dementia. Those are the stages that people move through as their dementia worsens over time. I'm a social worker who started out with the Alzheimer's Association some years ago, working with the adult daycare center we operated at that time. After that, I went into private practice as a geriatric care manager, working with families of older adults. I also provided consulting services to nursing homes around the state. I returned to the Alzheimer's Association about 8 years ago, and I work primarily with families and with educational programs. I also facilitate a telephone support group twice a month for people who find it difficult to get out to go to a regular in-person group. So we'll start with our module. Understanding Alzheimer's disease progression is really important to anybody who's working with families. It really helps us to have some idea of where that person is in the progression. When I meet with families, I often begin by asking them to read through a description of the symptoms people tend to develop at different stages. And this kind of helps us focus, both for me and the family, on a realistic picture of the person's abilities and the areas where they need help. So it's not unusual when we do that the family might have thought that the person was in early stage, and then they realize that she's actually well into the middle stages. And as you can see from this slide, the progression of Alzheimer's from diagnosis to death varies a lot from one individual to another. A person with younger onset Alzheimer's disease may experience a more rapid progression. For others, especially if there are no serious medical conditions, the progression may be very gradual and last 15 years or even more. We know that Alzheimer's disease begins with a preclinical or pre-symptomatic stage, which can begin decades before there are any symptoms. Mild cognitive impairment, or sometimes just referred to as MCI, may be the first symptomatic signs of this disease process, but MCI does not always progress into Alzheimer's disease. Those with MCI certainly do have an increased risk of eventually developing Alzheimer's or another type of dementia. Alzheimer's progresses through various stages, and here we're going to just use early, middle, and late. It's important to realize that Alzheimer's is a fatal disease. Pneumonia and other comorbidities often actually cause the death, and that's why Alzheimer's disease deaths are largely underreported on death certificates, even though it's really the cause. Though Alzheimer's disease has been reported to be the 6th leading cause of death in the U.S., a recent study showed that Alzheimer's deaths are underreported and may actually be the 3rd leading cause of death after heart disease and cancer. So as Alzheimer's moves through the brain, it's going to literally affect every aspect of a person's functioning. If another condition does not first cause the person's death, then Alzheimer's disease will eventually be the cause of death. And a lot of times families need help understanding that the person who's in late stages is having problems that really are directly related to the progression of the dementia and may not respond well to medical treatment as he or she has done in the past. That means that maybe the person has developed an infection, an upper respiratory or a urinary tract infection, and the family may be very disappointed when the person doesn't respond to the antibiotics that are given as they have in the past. And of course, the reason for this is that the disease is really weakening the body overall, and the person is moving toward, the last stage of the disease. But in the early stage of the disease, you might not even immediately recognize that the person has any problems. And it's important to keep this in mind as you work with people. You may have a lot of people, even on your caseload, who are very early in the progression, and the changes are not going to show up because they happen so slowly and might not even be noticed. Um, People can sometimes compensate for these symptoms very well, and they retain their social skills. So they can cover quite well, and you may not realize actually what's happening. People with Alzheimer's disease and related dementias and their family members, of course, may be in a form of denial or just simply not understand what's happening. One of the phrases we hear a lot around here is, it's not that he can't remember, he just has selective hearing. And we want to make it clear that the real problem is not that the person has selective hearing. It's really a very different kind of issue, because the issue is how the person is able to process the information coming in, and not his hearing. His hearing may be just fine, but what he hears no longer sort of makes sense to him in the way that it once did. During the early stages of Alzheimer's, people still have a lot of abilities, and it's important for us to recognize that. They generally do still have insight into what's happening to them, and they're experiencing a lot of losses, and they're becoming aware of those losses usually. Feeling sad and depressed is a very normal response to this experience. Although loss is experienced, the person is still generally able to make decisions and to plan ahead, but may be having trouble with things like finding the right word, remembering names, maybe misplacing things as well. The important thing is that in the early stages, the person is experiencing a shift from their previous state. Understanding a person's baseline helps determine if there has been a change. There are a lot of reasons that early detection of Alzheimer's disease is important. And among these are the things you see on the slide. It gives people a chance to execute advance directives and do their wills. If they're diagnosed pretty early, the medications are going to be much more effective generally in these early stages. And the person can just be a much more active partner in planning for their future and being able to participate in decisions and express their wishes to their family members. During the middle stages of Alzheimer's, it becomes clear to everybody that something is wrong. And at some point, it's also clear that the person really cannot manage independently any longer. During this time, memory, particularly short-term memory and thinking problems, become more obvious. And the person may be having difficulty with communication. They may not be able to communicate with full sentences, or they may not be able to understand clearly what is being said to them. So in other words, it can be both an expressive problem and, a taking in information kind of problem. Though a person may lose some verbal communication skills, though they retain nonverbal communication, and they're still very capable of reading other people's nonverbal communication. They know when we're angry or upset with them. They can read our body language and tone of voice very, very well, and so it's good for caregivers and all of us who work with people who have dementia to be aware of our nonverbal communication, because it is something that people are able to understand. Behavioral symptoms tend to begin during this period, generally because the person is becoming frustrated and feeling more fearful and vulnerable. These behavioral symptoms can be very challenging for caregivers, and we'll talk more about behavioral symptoms later in the training. As Alzheimer's progresses, people need more assistance with everyday tasks like managing money, shopping, using the telephone, taking medications, caring for pets, housework, just everything in general. And they're also going to begin to need more help with activities of daily living like bathing, toileting, and eating. So all of this, of course, adds up to the need for a lot more caregiver involvement. In these middle stages, people are still probably looking healthy and fine to outsiders. Many of them still have good social skills. They sort of nod and smile in all the right places and are able to respond to questions they don't have. They're able to dodge questions that they don't really have answers for. One woman was asked by her doctor who the president is, and she replied, "I have the same president you do." So you have to admire their skill at kind of being able to move around their deficits at this point. People often report that they're just fine, and even that they're doing things that they no longer actually do. For example, they might tell somebody that they prepared a certain meal when actually they haven't cooked in a long time. And during a 5 or 10-minute doctor visits, it can be pretty easy for somebody to pass. A doctor may not see what's really happening because they're only asking superficial questions or yes or no questions. Caregivers and family members are likely to report that there is a cognitive and functional decline, so it's important for family members to accompany the person to those physician visits in order to provide the doctor with more complete information. And if possible, we recommend that this be done in such a way that it doesn't embarrass or humiliate the person with dementia. Sometimes the family member might provide some brief written information that would be quietly handed to the staff in the doctor's office, or asking for a private meeting with the doctor to provide that very, very important information so the doctor actually does know what's happening. And we're going to look at a video of a person who is in middle stages, and we always remind people that every individual is different and the progression of their disease is different, but we'll take a look at this lady.
To run a little differently. How old were we when we sort of got into not lighthood, the medium-sized age?
Well, I guess I'm in medium-sized age because I'm 45.
You're 45.
That's medium.
Yeah, and I must be near 50 then.
Older than that.
Is it really? 50-something then. 60?
You know how old you are? 84.
I'm 84? I never thought of that, Debbie. I haven't thought of my age in years.
Oh, that's good. There's no reason to think about it. The first to go were the immediate memories, the really short-term memory. But she could remember a couple of years ago, maybe. And then that started to go, and essentially the part of your life that you remember is further and further and further back.
I don't think I know many people left from, where did we start with?
Well, you started in San Francisco.
Yeah, I guess I did.
And then you went to New York for a long time.
Who was I? Was I with somebody in New York?
You met Banish, and you lived with Banish for almost 50 years.
You mean working with Banish or what?
Yeah, you worked with him and lived with him.
I didn't realize that.
little by little, the only real remaining memories are childhood and very early adulthood. And she remembers her parents fairly well. But what I always thought of as her life, what I knew to be her life, which was me and my brother and my father and the 50-plus years that she lived in New York, that's kind of mostly disappeared, or that's just become a little puff that has occasionally some substance to it. Mostly it's kind of a blur, which was a little hard for me to take.
But of course, I would always know you because I've known you since you were little.
You knew me when I was born.
Were you really?
Because
I was across the street or something? Where were you born? What street?
169th Street in Flushing.
Oh, well, that's where all of us lived.
Right.
169th Street, yeah. So I knew you, I knew Francis, I knew, wait a minute. Well, wait a minute. Well, what did I do in between then?
Okay, I know you could see a lot of significant memory loss with this lady, but very pleasant and still has good social skills, able to interact with people. And, you know, one of the mysteries, I think, of having dementia is this come-and-go nature of people's memories, because although she was clearly very confused and didn't remember a lot of significant things about her life, when she was prompted, sometimes she was able to kind of accurately go by and go back and remember things that took place many, many years ago. In the late stages of Alzheimer's, you see much more of a sort of functional type of decline. The person's short and long-term memory continue to be affected, but they're also having a lot of trouble communicating with other people, both verbally and non-verbally. They're needing a lot more assistance with day-to-day activities and personal care. It's like the brain sort of hears but is unable to communicate with the body about what to actually do. So the person may actually hear and understand something, but they're still not able to kind of get that into a form that helps them respond physically. For example, they might be told to sit down, but they're unable to physically sit on their own. During the late stages, we see just a lot more physical changes. As the physical abilities decline, the person will eventually become completely reliant on others for personal care. Eventually, the ability to swallow and to control bowel and bladder functions, that is going to be lost. And again, death is going to result from Alzheimer's disease if the person does not first die of some other condition. We're going to take a little bit to look just at the risk factors that are involved with Alzheimer's and other dementias. And the most significant risk factor is age. If you live long enough, your chances of getting Alzheimer's disease increases. Alzheimer's can run in families as well. but the genetic mutations that can cause Alzheimer's disease are pretty rare. So if you have a family history, in other words, if you have one parent who had Alzheimer's, your risk is raised. If you have two parents with Alzheimer's, of course, that increases the risk. But those things are not absolute determinants either. We have still a lot of things we don't understand about exactly how this runs in families and is a risk factor. Head injury is we have increasing awareness about head injury as a risk factor. We've all heard about the football players who sustain a lot of head injuries over the years that they play, and then later in life develop some form of dementia. Then there's the heart-brain connection. We know that factors that increase the risk of cardiovascular disease that are going to increase people's risk of heart attack or stroke, that there is a relationship between smoking, obesity, diabetes, high cholesterol, hypertension, and the development of dementia. So we like to say what's good for your heart is going to be also good for your brain. We'll look briefly at screening and diagnosis. These are the factors that are taken into consideration with an Alzheimer's evaluation. We look at medical history, a mental status evaluation, of course a physical examination. Often people are referred to a neurologist who will run further tests. Lab tests can be helpful, brain scans and images, sometimes a psychiatric evaluation, and certainly interviews with the family and caregiver are needed to often complete the information that's being gathered. There is no single test to diagnose Alzheimer's disease, but doctors have been shown to have 80 to 90% accuracy in providing an accurate Alzheimer's diagnosis. Screenings can include medical history and all of those things we talked about. Once the diagnosis is made, families can work with their primary care providers to determine if medications are going to be helpful. And we don't have a lot of medications for the treatment of dementia, but the ones on this slide are the primary ones that are available. It is important to say that they only help with symptoms. There are no medications that slow or cure the disease process itself. And it's important to remind caregivers that because of people's memory loss and confusion, it's going to be important for caregivers, family members to be involved with helping the person to take medication correctly. These medications help some, but not all people. Some cannot tolerate the gastric symptoms that often go along with taking Aricept, for example. But because the medications do have potential to help a person think more clearly for a longer period, most physicians will recommend that they be tried. And there are significant benefits for some people. For example, we've had families report that the medications made it possible for their person to remain in the home longer. But there will be a point at the later stages when these medications will no longer be helpful. Thank you very much for participating in this webinar.